Thank you very much for the kind introduction, and everybody welcome to Nottingham. It's lovely to see some familiar faces here as well, which is really lovely. So I've been charged with sort of setting the scene of how we here in Nottingham support our children and young people who have diagnosis of brain tumour through their rehab journey. And I think the word journey is the most important thing as well to recognise, is that this isn't just one point, this is right from point of diagnosis throughout life. So in Nottingham, we very much believe that neuro-rehab starts at the point that you are admitted to the hospital with the concern, and then ultimately the diagnosis of a brain tumour. And that is involved with a wide multidisciplinary team, including the neuro-rehabilitation neurodisability consultant, physiotherapy, occupational therapy, speech and language therapy, psychology, both clinical and neuropsychology. The voluntary sector, we very much depend on the support of some of the charitable organisations. Our hospital school is critical in helping support all of our young people. Our specialist nursing teams, like Louise here today, our neuro-oncology outreach nurse, who is absolutely vital at being that voice and point of contact as well into the team for all of the young people that come through our service, and also social care with representation from Young Lives. And really, we support through the inpatient stay, during treatment, and then offer community outreach at times and follow up after the treatment's completed, especially if there is ongoing therapy needs. So I just wanted to demonstrate kind of the scale of what our challenges are. So whenever the East Midlands Children's Neuro-Rehabilitation Team, our BRIL team as we call it, was set up and commissioned back in 2014, we were commissioned for 40 patients, which is the start of the graph. And over the past 11 years, you can see that our numbers have just rapidly increased up till on average about 140 per year. And in the past year, just over a quarter, 27% of these young people that were receiving rehab with our team had a diagnosis of a brain tumour. So that was in the last year, there was 157 patients through the oncology pathway that were having neuro rehab. 39 of those had a diagnosis of a brain tumour. So this is the kind of pathway that we try to work to. So when a child or a young person is admitted to Nottingham Children's Hospital with a concern that they may have something like a potential brain tumour, they are admitted onto what tends to be our neurosciences ward and E40 or E39. They have investigation and management of the suspected brain tumour under the neurosurgery, neuro-oncology teams. And then at the point of a confirmation of a brain tumour pathology, they are then brought to us on a weekly MDT meeting where we discuss all of these patients with the neuro-oncology team and the whole multidisciplinary neuro-rehabilitation team. Throughout this time, there is assessment from our therapy and support team, so physiotherapy, occupational therapy, speech and language, all as a baseline assessment at the point of admission. Most of the time pre-operatively, if we can, if not post-operatively, and then ongoing therapy and neuro rehab support, including discharge planning meetings, school liaison team around the child meetings, all as needed. And throughout all of this, weekly MDTs with our neuro-oncology team discussing any concerns while as an inpatient. So really the neuro-oncology kind of leads on the management of all of the medical needs, with the therapy team supporting what is needed. And if they are referred to another centre for ongoing treatment, a referral then will be made to their local community or hospital therapy teams for support while they're there. But if they remain with us, inpatient ongoing therapy support from our inpatient therapy team with the rehab, and outpatient referral to local community therapy teams. Unfortunately, this is different depending on geographical areas. Unfortunately, there isn't equity of what there is available in all of the different geographical areas. And we do try to help support that with bridging as best as we can and to support. At the point of discharge, a neuro-rehabilitation outcome summary is then shared with the GP and the community teams as well. And each attendance that the young person would have at hospital, that would be updated to try to help support that communication with all of the team involved. So really it is very patient-centred, patient-specific, with pulling in all of the teams as needed. The crux of it is the child and the young person's at the middle of all of this. And then we try to bring in all of the teams as needed. So we think about the MDT and not just the health MDT. We think about education. We think about social care, and we bring in all of those professionals as well. If I know there's a talk later about educational healthcare plans, so we spend a lot of time, don't we, Louise, thinking about EHCPs and helping support and pulling together the information for that, and then reaching out to any of those other teams out there that might be able to help. For example, teacher for the visual impairment, teacher for the hearing impairment, if there is any of those challenges, endocrinology, voluntary sector, pulling everybody together as a kind of coordination. And then comes the challenge of transition into adulthood. So we try our best to support, but unfortunately as paediatricians, we can only do so much up until the age of 18, 19. And then we have to try to hand that baton over. And sometimes it is, who do we hand the baton over to? And that's where there is a challenge. But again, we try to coordinate this as best as we can, working closely with our adult colleagues. We're very fortunate that we have people like Mr. MacArthur, who looks after young people right through their life, that they are a constant person looking after the young person through. But a lot of the other professionals kind of dip in and out according to how old you are. But the main person as well that it tends to be is the GP. And unfortunately, we know the GPs aren't very familiar with all of the challenges that there is post a treatment for a brain tumour or the consequence of an acquired brain injury. But one avenue is if you have a formal diagnosis of an intellectual disability, that does register you for an annual health check with the GP every year. So at least that is one point of contact with the health professional every year to try to discuss any challenges that then they could reach out to the wider team to help support. Other professionals might be neuro-rehabilitation. We're going to hear from one of our adult neuro-rehab colleagues that we have here in Nottingham later, and we're reaching out to them as well to help support ongoing challenges that there might be, access and therapy services if needed in adult services. The neurosurgery long-term effect clinic, like Mr. MacArthur's already shared, neurology, endocrinology, but this is just an example. It's very much dependent on what the needs are and reaching out to the wider teams at that time. With everything, we've got challenges, we've got gaps. The main thing that we think is the re-access to specialist rehabilitation services and completion of treatment. I think the challenges is that we recognise the challenges that there might be as a consequence of the treatment and the late effects of potentially the chemotherapy, radiotherapy, but we often forget or kind of put to the back of our minds the ongoing acquired brain injury effect, and that may not be identified. So I think that's where we have a challenge that we're trying to think of how we can support that through all of our conversations and talking today. Because really the goal that I think would be really helpful is all children and young people who have a diagnosis of a brain tumour and ABI as a consequence have ongoing long-term developmental review with local community paediatrician, with them being the kind of coordinator, pulling all of these teams in and refer for further support as needed.